Hi, welcome back to our channel Mrcp made super easy. And now after I uploaded my first video, there were a lot of questions from different sources. There were a lot of confusion, I would say, rather. Everyone wanted to know about what textbooks to read for Mrcp, how much time they should dedicate for preparation of Mrcp, what is the Mrcp exams, what question banks to follow. So we decided to do this video to help you clear your confusions. So today we'll be talking about the ABC of Mrcp Part 1, which is serve as a complete guide to you for your preparations. And if someone comes to you asking about your Mrcp, how to prepare about it, you can always share this video with them and it will definitely help them. And at the end of this video, I'm sure most of you would have cleared most of your confusions that you have surrounding Mrcp. Right, so let's get into this. So what is Mrcp and who can give? Now Mrcp stands for Member of Royal College of Physicians, which is accredited to the Royal College of Physicians, and it is a membership exam basically. And who can give it? Now this paragraph I have taken from mrcp.org.uk, the official website for Mrcp, which clearly tells you that any person who has 12 months of minimum postgraduate experience in medical employment can give it. Now what does that mean? Let's say you have finished your undergraduation, you're just out of your medical school, right? You're a fresher. Well, after that you would need at least 1 year of employment, right? Or some kind of exposure to a postgraduate program, maybe internal medicine, or mostly. Okay, so if you're having a 1 year residency or postgraduate exposure, you are eligible to give that exam, right? Now the Mrcp is an amazing degree or a membership or a membership to have. It definitely improves your knowledge a lot, right? Compared to your counterparts, you would feel that you are at par with them, in fact better than them when it comes to knowledge, right? It glorifies your resume, right? And in fact it helps you in a lot of ways which you can't even imagine, right? So the other thing is people ask me about is Mrcp examinations. What is it? Now if you look at the slide, it comprises of 3 parts: part 1, part 2, and then there is the basis. The part 1 comprises of 2 written papers, 100 multiple choice questions, and you have to pick the single best option or the single best answer which you feel is right for that question. Now how does this work? Let's say for part 1 you go in the morning, you'll have 2 papers. First will be 3 hours, after that you'll get a lunch break time or a break, after that you come back and take the second paper. And then you have the second paper which is more of a written paper, and then you have basis. Basis, basically you have different clinical stations which will test you on your attitude towards the patients, your approach towards the patients, how you approach the patient in a systemic manner, your clinical skills, examination, how you arrive at a diagnosis, right? And your bedside attitude overall. So that's what they're judging you when you look at basis, right? So I'm not going to go much details into it because it's not the topic that we are talking about right now. Now this is something that people say, that duration, how many hours do I study? Now that number of hours varies from person to person. It's more of an it's individualized is what I would say. Some people are able to grasp more in short span of time, whereas others need a bit more time to actually get hold of things. So I've tried to generalize this by dividing people into 3 categories. The first category is if you're a fresher and not working. Let's say you're out of medical school right now. I wouldn't recommend personally going for Mrcp directly as soon as you're out of your medical school. Why? Because you don't have that much amount of clinical exposure. Your diagnostic skills aren't pretty good, I mean, because of lack of experience, right? So your approach, all these things matter. But if you are still you feel that you want to prepare for this exam, then I would say you need to put in at least 8 to 10 hours every single day for the next 1 year. The second category is if you're working as a resident and a fresher. Let's say that you're into your residency program, first year or second year or final year of residency program, right? Or let's say you're just a resident who has started working and you are a fresher. So for that I would say you need to put in 6 to 8 hours of study time for the next 6 to 8 months. Now the third category where majority of the people fall is they are working in some department and they are preparing for MRCP. I would say 4 hours of quality studying every day for the next 4 months should be enough to help you crack this exam. Now I've put in this screenshot of when this exam is held. This is the 2022. Next exam will be, this is the application date, exam date for next 2023. The first, second, and third lot. You can look at it, and the same website is the same information is available on the website as well. A small tip on this: if you're registering, do know the time period. Let's say it's 26th September. Try to find out the time difference between the UK time and where you are located. And when it's 26th September, open the application and try to apply as soon as possible. Because if you delay, your choice of examination center will not be available. So, in order to avoid that disappointment, ensure that you book an early slot and you fill in the application as soon as possible. Right. This slide basically tells you about the various systems on which you are tested in the exam. So 200 multiple choice questions. The most important, as you can see, it's highlighted with stars, is clinical sciences. You get 25 questions from this. Then you have clinical pharma and therapeutics, 15 questions, followed by the major systems: cardio, endocrine, gastro, infectious disease, neuro, renal medicine, respiratory, and rheumatology. The other systems, psychiatry and dermatology, and the others are equally important. So do not skip them, because the content, let's say in geriatric medicine, palliative, is pretty less, right? There are very little things that you need to remember. So they are quite scoring subjects. So do them well. You can take a photograph of this and you can keep it. You can paste it on the wall wherever you're studying, so that when you do a system, you're able to understand its importance. So that way you'll be able to focus in a better way and do these systems really, really well. This is basically the subdivision of the clinical sciences, the further subdivision of the things that it can be included in clinical sciences. Of course, this is all available on the website. Next, textbooks. There is a huge confusion on this, especially when it comes to textbooks and question banks. What I say is, follow one single book religiously. Now what happens is, we start with one textbook and then we switch on to multiple books, because our friends are doing a different textbooks than we are. So we feel that, oh, I'm supposed to be doing this book. What happens is, you end up going nowhere with this. So pick one textbook, do not have any self-doubts, and follow that textbook till the end, right? It's like picking a life partner, right? You are sure. So let's say you pick a life partner, you don't leave that person midway in between, right? Because someone else has a better partner. Same logic. Yeah. So pick a book, follow it properly. Do not leave it midway. Don't leave it hanging in between. Because, hey, come on, books have feelings too, right? Just kidding. Anyway. So, the first book is Notes and Notes by Yusuf Abdullah Hamad. Now, this is an amazing book. Why do I say that? Because it has every single information that is there to be known to you, whether it be part 1 or part 2. Problem is, the content is so much and so vast that if you have less time to study, you would feel like you're getting lost into it and you're unable to recall or you're unable to retain anything. So let's say if you have around 10 months or a year of study, pick this book up, follow religiously. It's an amazing book, And if you are someone who has an amazing recall memory and retaining memory, go for this book. Again, the choice is yours. The second book is Step Up to Mrcp. I think most of you would have heard of this, by Dr. Mrcp. Amazing book, again, good book. But the only problem is it is too short into, you know, the topics. They don't really go into details. So if your basics are not strong, if you don't know why or what happens in a disease, you don't know the pathology, you don't know the physiology of it, then it will be difficult to understand this book. So have a standard textbook next to you, like Davidson. You can pick up this book, have Davidson, and if you don't understand a topic, read it through Davidson. Or we have so much sources available on the internet, so you can go and understand any topic that you want from the internet itself. Come back to this book and read, and then solve questions accordingly. The third book, the only notes you will ever need, again similar to Mrcp, has the same things, same topics. You can follow either one. So if you have less time, follow either Step Up to Mrcp or go for only Mrcp notes that you will ever need. If you have a lot of time, pick notes and notes. Question banks. So there is a lot of confusion again with question banks. People say, do I read past medicine? Do I read past test? Do I do PMJ? What do I do? Well, don't worry, I'm here to help you. If you are starting your preparation, close your eyes, pick up past medicine. Why do I say that? Now, past medicine is quite simpler. If you start solving the questions, you would feel that the questions are easier to solve. Now, past medicine helps you build that confidence. It familiarizes you with the questions and the topics that you are tested on. So do past medicine at least twice, right, before you shift to any other question bank. Start with past medicine, solve the questions from past medicine, go through past medicine one more time, and then you go to past test. The subscription of past test is a bit on the expensive side, but it is the questions that you get on past test are similar to the ones that you get in the exam. Now, if you start doing past test as the first question bank, you would feel that the questions are a lot more tough and your confidence is going to take a hit because you'll not be able to solve them. So start with past medicine, familiarize with the concepts, build on those concepts, revise, become confident, then come to past test, and then you would enjoy solving questions. Trust me on that. The next thing is on examination, BMJ. I'm not too much in favor of this. It's more or less, it's somewhere in between past medicine and past test. So if you have time, you're done with past medicine, you're done with past test, you can go with this. But if you skip this also, it's not a problem. But ensure that you do past medicine and past test. Next, we'll look at how to study in a planned approach, in a systematic approach, in a smart way for MRCP. So I've put in some tips in the next slide. Let's look at them. I used something called as Anki flashcards. Now Anki is basically you have already you have MRCP flashcards available on Anki. You just have to download it. Now the advantage with this is it helps you retain and builds on your recall memory in a better way. Now let's say I'm a resident, I'm at work, I don't have time to pick up my book, right? I can open Anki on my phone and I will see a flashcard where there is a question and then there is a space for the answer. So it will force me to think what the answer is. I keep looking at those flashcards and then it registers in my subconscious mind, and before I know it, I'm able to retain and recall in a better way. So you can use Anki flashcards. If you need the link for the Anki content, I can put it in the comment section, so do let me know if you need it. The next thing is audio. What I do is I record whatever I studied the previous day, especially when I'm revising. So when I'm at work and I don't feel like looking at my book, I play the audio of my own voice. That way I'm able to remember, oh, this is what I was revising, this is what I was reading. So uh, you know so even when I'm not doing anything, not consciously try to study a topic, I'm still running it because it's playing in the form of audio, right? So I'm listening to it. So there is, I'm still learning in a way. The other thing is have a planned approach. Do not try to sit for 6 hours, 8 hours at a stretch and try to cover things. But this is something important. Do at least 15 topics a day. Why do I say that? Monday to Friday, make it a point that you do 15 topics per day, and Saturday and Sunday revise those 15 topics. And when I say 15 topics, it does not mean in a systemic approach. Let's say I'm doing neuro, let's say I'm doing spinothalamic tract, cranial nerves, and I'm already saturated. Pick up psychiatry, pick up dermatology, ophthalmology, or any topic that you like. Read it, but ensure that you do 15 topics, right? Avoid mugging up. MRCP is not an exam which you mug up and you give. It is more about clinical approach, and it's more built on your basics. Use mnemonics wherever possible. Let's say you're reading pancreatitis. You have a mnemonic for pancreatitis which is called I get smashed. I for idiopathic, G for gallstones, E for ethanol, T for trauma, S for steroids, mumps malignancy, and so on. So there are different mnemonics available. For, let's say, autosomal dominant conditions you're trying to learn, there are mnemonics available for that. So you can again put a comment in the comment section if you need mnemonics, and I will put a link to it as well. On YouTube, if you type picturize, you will get different links. The advantage with picturize is, especially if you're learning genetic disorders like Down syndromes, Edwards syndrome, picturize helps you remember things in a picture form. They connect things in a picture form, so it helps you remember in a better way and retain in a better way. If you don't understand any topic, you can try using Osmosis, which is again a great website, which is quite simple to understand. Like I said before, do not try to go in a systemic system-wise approach. Pick too many tough topics to study. 2 days a week for regular revision. Follow one book religiously. And last but not the least, attempt the exam only when you are confident. Why I say that is, let's say you are unsuccessful at clearing the exam the first or the second time. Your confidence is going to take a hit, and you would be stressed out. Now, stress is not good when you're studying. So when you're confident, when you're solving questions, when you think that you're ready for the exams, go for it and go and give these exams. So I hope I have covered everything in my video. If you still have any doubts, please do write to me. I'll be more than happy to help you out. Anything related to MRCP, please do like, subscribe, and share our channel. And yeah, if you have a particular difficulty in any topic, do let us know. We'll try to do a video on that as well. Thank you so much. Keep reading, keep revising, keep smiling always, and relax. It's all gonna be okay. Don't stress yourself too much, right? Just follow what I've told you, and I'm sure all of you will clear these exams. Thank you.